We have been married for 5 years, but still not have baby.
Are you saying there is something wrong with me?
Don't you want to check? I heard women have higher risk of infertility, such as menstrual cycle problem, infertility problem, implantation problem, and others.
Then how about men? You can be infertile too. The causes can be cigarette smoking, alcohol, diabetes, depression, abnormal sperm production and formation. That's why I told you to quit smoking, but now you blame me.
So, it's all my fault?
Yes, exactly.
Quit nagging. I want to watch TV.
Hi, welcome back to Misbah, and I am Dani as your host. Today, we will talk about something that new and something that we need to know. Okay. Today, our topic is about help in getting pregnant. But nowadays, there's a various of method or treatment that can be done by the unfortunate woman to help them to getting pregnant. Don't be shy to share your problem. Okay, doctor first. Dr. Fatim, I want to ask you because you really have a lot of experience in handling patients. They have unfortunate life to have a baby. Okay, doctor, I ask what is the best treatment to help the unfortunate woman?
Okay, thank you, Danny. Yes, actually there are lots of methods to help women to get pregnant. In Malaysia, we have actually it's not in Malaysia, in over the world. We have introduced the ART, which is Associated Reproductive Technology, whereby ART is the assisted technology to help women to get pregnant. Whereby this ART works like we stimulate the ovulation for the woman to get pregnant. So in ART, we also have ovarian induction, whereby the ovarian induction is the procedure for the woman that does not have ovulation regularly or does not have ovulation at all. This procedure is actually the doctor will inject the hormone, especially the FSH and LH hormone to the woman, so that the ovulation will happen and new and strong egg will be produced for the next implantation and fertilization. The next method is IVF, in vitro fertilization. IVF is used for the women that have blockage in fallopian tube. How the IVF works? IVF works is actually we take the ovum and the sperm and culture it on the laboratory. So we culture and fertilize it inside the laboratory. So after fertilization occurs, that result of fertilization will be inserted back into the mother. So beside the IVF, we have also GIFT, whereby GIFT is the natural method form of the IVF, whereby we doesn't instead of we culture it, we fertilization it inside the fallopian tube of the woman itself. We take the egg from the woman and implant it in fallopian tube, and we injected the sperm into the woman, so that fertilization is occur inside the fallopian tube itself. However, GIFT is actually not common in Malaysia.
Thank you to Dr. Fatim for the sharing about the treatment that can be used in Malaysia. As we know nowadays, to all the women out there, don't be afraid because there are other treatment that you can use. There are technology. The name of technology is assisted reproductive technology, ART. They have been explained by Dr. Fatim. Okay, next, I would like to ask the Dr. Carolina first. Doctor, what is your opinion about the surrogate mother? Nowadays, there are people that want to use a surrogate mother to get the baby, but what is the doctor's opinion about that? And can the doctor explain more the other treatment that can be introduced to the unfortunate woman? Okay, doctor.
Just like Dr. Fatin had explained before about the IVF, the surrogate mother is using the same method as IVF. It's just that the fertilized egg is not put back to the woman, to the mother, to the original mother itself, but they use another woman and implant the egg inside the uterus of the other woman. So basically, to me, in my opinion, surrogates mother issue is a kind skeptical in Malaysia, in which is it is not used. But majority in Western countries, they are practicing the surrogate mother, and actually they got paid if the woman willing to become a surrogate mother itself. So the next other treatment that I want to explain about is one of it is called artificial insemination. This artificial insemination is used by male who are usually having problem in erection and also problem in their penis structure. So basically, it is same as IVF, but the sperm itself is taken from the male, and the semen is taken from the male, and the semen itself is inserted into the woman's uterus. So the next one is donor conception. Donor conception, male and female can donate their sperm and can donate your ovum. So basically, the method is the same whether they want to fuse it inside, fertilize it inside the petri dish or inside the lab, or they want to fuse it together inside the woman's uterus. So usually this type of method is used by women who is having the high risk of passing genetic diseases, and also women who has experienced several of miscarriage. So last but not least is we call it intracytoplasmic sperm injection. So this method is used by male who are having problem in their sperm structure, in which the structure of the sperm is not complete, or maybe the tail is a bit short, that doesn't allow the sperm to swim to the egg. So we use this intracytoplasmic sperm injection, in which the doctor will choose the best sperm inside the semen, and of course they will fuse it together with the ovum of the female. So that's it.
Okay. Thank you to Dr. Carolisa for explaining to us about the other treatment that the man use if the man cannot if the man had a problem with his sperm or had a penis structure problem. Okay, thank you, doctor. As you know, infertility can be occur to both gender, male and female. But both doctors today, they have been explained to us what's the treatment that can be done by the infertility man and infertility woman. And I hope that all the viewers out there, they can take this chance and go to our hospital, visit MSU Medical Center, because we're willing to help you. Thank you.
Hello, my name is Dr. Misbah. I'm a specialist in male and female reproductive system. May I help you?
You want to consult with you about our problem. We have been married about 5 years, but we still do not have
Can I ask you a few questions? Do you have any disease or take any medication? If yes, what kind of medication that you take? No medication.
so far.
Okay. Do you smoke, take extra or drink alcohol?
One pack for 1 week. Smoke.
Smoking. Smoking. And then, do you practice contraceptive method? In your field, practice contraceptive method?
No.
The question, how often do you have period over the last year? And do you have included or missed periods?
For a few months ago, I had a menstrual cycle, which is for women. I have my period as usual, but for another one, I don't come with.
Do you have undergone treatment for infertility before?
No.
This is your first time
This
visiting
is
the
our first time.
this is the result from the lab, the result for your semen result and your blood sample result. Okay. From the semen result, for your sperm result, does have any problem with the sperm or any hormone level? Everything is good, but the second one is your wife had a problem with the hormone level, especially the hormone is FSH.
So, what is best treatment for my wife?
Okay, for the treatment, there are several treatments that both of you can choose for your wife, okay, such as you can see that.
What is the treatment for men?
There are many different infertility treatment. First, changing lifestyle factor, which is stop smoking, stop drinking alcohol, and also exercise regularly. Second is for medication, which is to increase testicular function and also to increase sperm production and quality.
What is the best treatment for women?
Treatment for women, stimulating ovulation with fertility drug. Fertility drug main treatment. This medication can induce the ovulation and intrauterine insemination. The sperm will be directly put into the uterus. And lastly is the surgery to restore fertility.
Okay, Doctor, what is the best treatment for me?
Okay, from the treatment, I think the best treatment for you is ovulation induction treatment. This one is the fastest treatment we can do, and you also can get pregnant faster. Do you agree on to get the treatment?
Yes, I agree.
You agree, so?